Maryland's Firearms Safety Act of 2013 has been called one of the toughest gun laws in the country. But for as many new restrictions this state now puts on gun ownership, the law also finally makes Maryland do what 38 other states had already been doing.
We are talking about reporting some of those with mental illness to the federal government for the purposes of a firearm background check. It has been federal law since the 60s, a law Maryland just started to follow as of late last year, closing what some say is a dangerous loophole. For Colin Goddard, the reality hit as hard as the pain.
It was like a sharp burn, kind of stinging feeling that kind of then soon faded into this kind of warm, wet numbness. And it was that moment, coupled with the smell of the propellant, smell of the gunpowder, where I just realized, like, I just got shot.
Goddard would be shot 3 more times while under the desk in his Virginia Tech French class. Of the 17 people in that classroom, he would only be one of 7 people to survive that part of one of America's deadliest mass shootings. Colin was gravely wounded, but alive, and left to ask what so many did in 2007. Why? Who? How?
The person killed himself at the end of it, so the why became a question we could never answer. So what became a more answerable question is, how did these shootings happen? How did this shooting happen? And in going down that road led me to a world I knew very little about.
Goddard and others realized the Virginia Tech shooter should never have been able to purchase the guns he did. His mental health records disqualified him federally, but the state of Virginia never forwarded those records to the FBI's National Instant Criminal Background Check System, a loophole the shooter exposed with 32 lives and hundreds of rounds of ammunition.
Something as simple as a file transfer from one agency to another agency could have altered the series of events that nearly got me killed and killed 32 of my classmates. It was just shocking, like, how simple, a change in that area could improve things.
Goddard, now a senior policy advocate at Everytown for Gun Safety, set out to prove just how simple it was. Since Virginia Tech, and for many states because of it, the loophole has been closed. Since 2011 alone, the amount of mental health records reported to the federal government for the purpose of a background check have tripled. Maryland is a little bit behind the ball on reporting these statistics to the federal government, correct?
Yes.
Dr. Beth McGinty, an assistant professor at the Johns Hopkins Bloomberg School of Public Health, says Maryland is toward the bottom tier of states to finally come around. It was the passage and enactment late last year of the Firearms Safety Act of 2013 that finally closed the loophole here in Maryland. Prior to it, the state only reported about 300 mental health records to the federal government for the purpose of a firearm background check. But in just the 9 months since that bill became law last October, that number has jumped to roughly 6,000 records. According to Everytown for Gun Safety, Maryland has gone from near worst in this category to a top performer. From your perspective, is Maryland moving in the right direction now?
Yeah, absolutely. That involuntarily committed group is the group we know that's at heightened risk of violence, and so going from 0 to 5,600 is a very big step.
McGinty says studies and evidence show that targeted population is at a higher risk of violence, and Maryland finally got around to closing what proved to be a dangerous gap and remains a constant topic of conversation around mass shootings and gun violence, a conversation others feel is being painted with a very broad brush.
This constant dialogue around violence and mental illness really makes this not an open issue.
Jeff Richardson is the executive director of Mosaic, a community behavioral health provider. He says this debate surrounding the mentally ill and mass shootings is creating a stigma not just around mental health, but the idea of seeking help for it. Laws are laws, but Richardson and others feel it may only be the Band-Aid on a much larger public health concern.
It really doesn't address the broader issue about how we provide services and help to our communities. And if we truly want to make this a safe, healthy community, we should make mental health services much more accessible, resource them much better than we do now, and help reduce the stigma and open up the access to this level of care.
But part of that is restricting some patients from access to a firearm and convincing the more than 10 remaining states to fall in line with a 46-year-old federal law.
I know Maryland was a little late to the game compared to other states, but this is such an important issue, it's better late than never.
Now, part of that total number of mental health records reported to the FBI come from our judiciary. They include those found mentally incompetent to stand trial or found criminally irresponsible because of illness. As of today, we're still waiting on those specific numbers. But in the Maryland Firearm Safety Act of 2013, there is also provision for someone to have their gun rights restored after having a disqualifying illness. According to the Department of Health and Mental Hygiene, 6 people have applied to get their gun rights restored. 5 were granted that right, and 1 still is under review. For a broader national look at this issue, including which states have yet to close this loophole, log on to our website at abc2news.com/infocus.